Hey everyone, today we're diving into one of the most powerful human experiences out there, childbirth. Now, we've all seen it in the movies where it's all about the drama, but we're going to look at it a bit differently, not just as a medical event, but as an incredible journey with a clear path and some very important players. So, what's really going on in there? Beyond the Hollywood drama, it's this beautifully orchestrated physiological event. But, how does it all actually work? Well, our goal here is to pull back the curtain on that whole process. We're going to break down labor and delivery step by step so you can see exactly what's happening from the very first signs to that final moment of birth. Okay, let's get into it. To really get a handle on this journey, you first have to meet the key players. You see, every single labor experience, no matter how different it looks on the outside, is shaped by the interaction of 5 core factors. That's right, 5. They're often called the 5 Ps, and believe me, they cover everything, from the baby itself all the way to the mother's state of mind. Understanding how these 5 things work together is really the key to understanding how any labor unfolds. So the first P is the passenger, and yep, that's the fetus and the placenta. The baby size, its position, like is it head down or maybe feet first, and even the precise direction it's facing, all of that plays a massive role in how it's going to navigate the path out. Next up, you've got the passageway. This is the actual physical route the passenger has to travel. It includes the mother's bony pelvis, and this is a big one, the cervix. The cervix has to soften, thin out, and open up completely to basically create the exit. Our third P is powers. Think of this as the engine driving the whole thing forward. The primary powers are those uterine contractions that happen automatically. They're doing the heavy lifting of opening the cervix. And then you have the secondary powers, which is the mother's own pushing. And our fourth P is position. And this one is all about the mother's posture. It's amazing what a difference this can make. Just changing positions, from walking to squatting or kneeling, can make things more comfortable and actually use gravity to help the baby move down. And finally, our fifth P is psychology. This is that powerful mind-body connection we hear so much about. Stress and anxiety can literally release hormones that slow labor down, while feeling calm and supported can help it move along. The main thing to get here is that none of these 5 Ps works alone. They're all in a constant dance with each other. Okay, so now that we know the players, how does the journey actually kick off? How do you know when it's the real deal and not a false alarm? Well, the body starts dropping some pretty clear hints that things are getting ready. These are what we call the premonitory signs. Kind of like a trailer for the main event. In the days or even weeks leading up to labor, you might notice stuff like a nagging low backache, a little bit of weight loss, or that feeling of lightening, which is when the baby drops lower into the pelvis. Some people get this sudden burst of energy, we call it nesting, all while the cervix itself is starting to soften up. But this is the million-dollar question, right? Is this true labor or just a dress rehearsal? The key difference is consistency. True labor contractions get into a regular pattern. They get stronger, they get closer together, and they don't stop if you change positions. False labor is usually irregular and might just fade away. But the real definitive sign, it's what's happening to the cervix. In true labor, it's progressively changing. So once it's confirmed, yup, this is true labor, the journey unfolds in 4 distinct stages. Let's map out how this whole path builds from the beginning right to the very end. So here's the basic roadmap. Stage 1 is all about the cervix dilating or opening. Stage 2 is the active pushing that leads to the birth. Stage 3 is delivering the placenta. And then stage 4 is that immediate recovery period right after. All right, let's zoom in on stage 1 because it's the longest one and it's actually split into 2 phases. First, you've got the latent phase or early labor. This is from 0 to about 5 centimeters dilated, and the contractions are usually milder. Then, things really kick into gear with the active phase, from 6 all the way to the full 10 centimeters. And as you can see, this is where contractions get much stronger and closer together, and a mother's focus really turns inward. Once the cervix hits that magic number, 10 centimeters, we are officially in the second stage. This is it. This is the pushing stage. It starts with full dilation, and it ends with the birth of the baby. This is where the mother's secondary powers, her active pushing, really come into play to help the baby finish the trip. Now, this part is just incredible. The baby isn't just a passive passenger here. It's performing this amazing series of maneuvers. It has to engage in the pelvis, move down, tuck its chin, and then do this series of complex rotations to navigate the twists and turns of the birth canal. It's like this brilliant corkscrew-like dance, and it's all happening instinctively. So the baby is here. But wait, the journey isn't quite over yet. Now we enter the third stage, delivering the placenta. This usually happens within a few minutes to maybe half an hour after the baby is born, and it's a really crucial step to make sure the uterus can contract back down properly. And here's a fascinating little detail. The placenta can actually come out in two different ways. There's the Schulze presentation, where the shiny baby-facing side comes out first, and the Duncan presentation, where the rough, maternal-facing side appears first. Just a small but pretty cool variation in the process. So the baby's arrival, it marks the end of one huge journey, but it's also the beginning of a brand new and very critical phase, recovery. This is the fourth and final stage. It covers the first couple of hours right after delivery, and the focus here is all about maternal stabilization, making sure the body starts to return to its non-pregnant state, and of course, that all-important initial bonding with the newborn. During this fourth stage, the healthcare team is watching a few key things very closely. They're checking vital signs, the firmness of the uterus, the amount of bleeding, which is called lochia, and all the while, they're making sure that mom and baby are getting that time to start bonding. You know, all of this really brings us full circle. Childbirth isn't just some random thing that happens. As this quote says so well, it's a purposeful, physiological process. It's this incredible collaboration between a mother's body and a baby's own innate drive to be born. So I want to leave you with this thought. After breaking down this whole intricate journey, from the 5 players to the 4 stages, how does understanding the mechanics of birth change your perspective on the sheer power and really the intelligence of the human body?